Most Americans, I think, are aware now that our economy has been in a recession for the last 14 months or so, and has impacted every state differently. My state of home, Connecticut, is no exception. And while the effects of the recession took a bit longer to hit my state than others, economists believe that Connecticut may take longer to recover for a variety of unique reasons, the kind of jobs we provide and the like. We've lost about 125,000 jobs in my state. Close to 20,000 homes have been foreclosed. One of my cities alone, Mr. President, Bridgeport, has had 5,000 foreclosures. One city, 5,000 foreclosures. That means our efforts to get economy moving in this bill are going to be important to families all across the country, and certainly my state is no exception. We're addressing many priorities with this economic recovery package, providing urgent help to communities who are struggling in the midst of this recession while making a down payment on long-term needs, as the new President Obama, has said and articulated in Indiana and Florida and Illinois, where he has spoken to in town hall meetings about this over the last several days, as he did in his first nationally televised press conference. At a time when layoffs are increasing the rolls of the uninsured, this bill provides $26 billion in health care premium assistance to unemployed workers. I can't begin to tell you, Mr. President, how important that is. I've held 2 town hall meetings in my state in the last 2 weeks on health care. I had one at 8:30 on a Monday morning, a dreadful time to hold a town hall meeting, obviously. We anticipated maybe 75 people might show up. We held it at a small community college on the banks of the Connecticut River outside of Hartford. 700 people showed up at 8:30 in the morning to talk about health care, to talk about what they're going through. The discussion was supposed to be about coverage specifically. We had 3 of these planned, one on coverage, one on cost, one on prevention. But the conversation was far beyond the issue of just coverage. 7 up at 8:30 in the morning. And these were people who had either didn't have coverage, most had coverage, but couldn't afford the 42% increase in premiums they've seen in the last 6 years. And then last Saturday at Western Connecticut State University at 2:30 on a Saturday afternoon, not exactly, again, an optimum time for a town hall meeting, 500 people showed up to express their views and to listen to some professionals in the field talk about what they thought ought to be included in a comprehensive universal health care program. One I hope that will be charting and moving on very, very quickly here. I know my great friend from Montana, the chairman of the Finance Committee, Max Baucus, is already deeply involved. Senator Ted Kennedy has been a champion of this issue for decades, and while he's struggling with his own health issues, he's on the phone every day, he's talking to everybody, and he wants his committee to be deeply involved in this effort as well. But in the midst of it, until that gets done, more and more people, the 20,000 a day who lose their jobs, if they had health care, losing that as well. So the fact that we're providing $26 billion to help out unemployed workers at a time like this, I think most Americans, most, not all, but most Americans, would say that's the right thing for a country to do, with hardworking people who, no fault of their own, find themselves in an unemployment line today or tomorrow or next week, to know that on the fear and fright that you may have a health care crisis with you or your family, and all of a sudden don't have the capacity to deal with it. These people didn't lose their jobs because something they did wrong, and they shouldn't be put in a position where their ability to take care of their families when it comes to their health needs are going to be disregarded. To ensure that we have safe, affordable shelters during these tough economic times, there's $4 billion down payment on an estimated $30 billion backlog for capital repair needs in public housing. And again, an awful lot of people out there are falling behind. That'll put people to work, too, by the way, which is obviously the major goal here, to get people to work. And as we see more two-earner families struggling to make ends meet, I'm proud and pleased that people in my state, in Connecticut, will receive a little over $1 billion in Medicaid assistance. And I can tell you that every state in the country, every governor, has been asking for assistance in this area. We have a very popular program in Connecticut called the Husky Program, Mr. President, and that is our Medicaid program. It's been strongly supported across the political spectrum, and this assistance will help out tremendously in that area. I'm also glad that we're able to include some assistance for our first responders. Fire departments in my state are reporting that they're turning down awarded what they call SAFER grants. Those are funds matching grants to put additional people in these rigs. You ought to have at least 4 people in a rig going out to deal with these fires and contingencies, or rather problems that they have to face. Those numbers are dwindling. This bill provides some assistance and support for first responders, and I'm pleased to see that's the case as well. And we allow the stabilization funds to states to provide for public safety and other critical services. That was a change, and I think a welcomed one. Across our state, from city to town, communities faced with budget deficits are crunching the numbers to maintain critical education, police, fire, jobs, and services. The town of East Hartford, Connecticut, was forced to lay off 8 municipal employees and eliminate 11 positions that will be vacant because of retirements, including firefighters and police officers. City of Stamford, counting on $500,000 in state assistance that was eliminated in the state budget over the last several days. Their $16 billion overhaul of the police and fire radio systems, the interoperability, will now get some help. The communities of Farmington and Colchester, Connecticut, are trying to replace decade-old fire engines. And again, this kind of help and support will be critically important to them. These stabilization funds will help communities in my state and others across the country to prevent layoffs of these first responders, the firefighters, the police officers, that are so critical to the well-being of our communities. Our community safety must not go left behind during these economic downturns. And while the comprehensive economic recovery package before us today will provide critical support for a broad range of additional needs, these are 3 issues in particular, Mr. President, that I want to focus on today. The first item I wish to highlight is an amendment I authored to restrict executive compensation and bonuses. I want to thank the Majority Leader, Senator Harry Reid, and his staff and others for making its inclusion a priority. Now, let me quickly say on executive compensation, in some ways, we're looking at incredible numbers that some people are receiving. In the context of the overall problem that we're facing, this is not the largest item financially. But when the American people wake up in the morning and they see that some institution that just received billions of dollars, find that 700 of the employees receive incomes each year in excess of $1 million, people ask themselves, what are you thinking of? We're not opposed to the idea of people getting compensated for the performance that they create. But the idea that we continue to pour billions of dollars into institutions that are still awarding their employees massive amounts of income is infuriating. Infuriating hardly describes the reaction of the American people. And so while I'm certainly sympathetic to some degree, this is about trying to save an economy in our country with 20,000 people losing their jobs every day. And I promise you the overwhelming majority of them are making nothing like $1 million a year or $500,000 a year. They'll be lucky if they're scraping by 30 or 40 or 50,000 to raise a family of 4. And when they see their tax dollars going out the door into institutions that are then in some cases not lending, hoarding, doing other things, I can't begin to describe the anger that we hear. And then we turn on and say to that same taxpayer, by the way, we need to have you step up and do more because, frankly, the economy needs assistance and help. But needless to say, Mr. President, the American public are reacting to this. And if you have any hopes whatsoever of convincing the public we're on the right track,
Senator's time has expired.
I would ask unanimous consent for 3 additional minutes, if I may.
Without